Good morning. It's a great pleasure to be here today with you and to have this opportunity to share some thoughts about the health space and how the health space is moving. And also particularly because it is the second keynote speech after 10 years. And we all know that we have been through very turbulent times, but the system is resilient and the system is still there. So I'm very happy to be able to share with you some thoughts and experiences, particularly because most of you are entrepreneurs or investors. So what I would like to do for my 45 minutes is organize that in 3 parts. The first part is going to be to share with you very rapidly what I'm doing today, so you have some context about what I'm going to talk about the health industry. Then I'm going to talk about some comments about health, and then we are going to have Q&A sessions, which is what I like the most. As far as I'm concerned, what I'm doing and what is my passion is that to help entrepreneurs, I am an entrepreneur myself, but to help, for example, scientists or inventors to create a company, bring the company to a certain level. And at the beginning, I'm very active in the companies. I'm doing from the CEO, the CFO, even the coffee. And then as we grow, I hire a CEO and I play an active role as a board member or as a chairman of the company. And I would like to mention 4 companies for you in the context of what we are discussing today. 2 of them in the life science space. 2 of them are based in Switzerland. Why? Because Switzerland is a very nice environment for life science, and there is a lot of innovation. And the first company is called Anekova. You will see that in the profile. And this company started with a doctor that came to my office in 2004, telling me that he has a new idea to do in vitro fertilization in vivo. So for the first days of life of embryo, instead of doing that in the lab, he had the idea of doing that in the maternal environment. I am an electrical engineer, so I don't know a clue about that. But I did my homework, and we arrived to the situation to create a company together. We have developed a device, and we already have had 14 children, and we have proven that in vivo fertilization is possible, which is better for the mother and is much better for the embryo. So this is one company. I'm actually the chairman of the company, but this started as managing the project at the beginning, and we were growing as the results were there. The second company is a bit different. This is more in biotech. This is a group of scientists and the former head of R&D of Nestlé that came to my office saying we have an idea for Alzheimer. We think that we have a path to find a cure for Alzheimer. And again, I trust the team. The only thing I ask them is that if you want to have a cure, you have to have a diagnostic also, because if we don't diagnostic Alzheimer on time, if we have a cure, this might be too late. So in this company, I'm the chairman. I'm active in this area. We are progressing very well. I'm pushing them because the time passes. And we have a certain number of antibodies and vaccines in phase 1 and phase 2. And we have an agreement with Genentech for an antibody that just started a couple of weeks ago, a phase 2 study. So those are the companies in Switzerland. In Scotland, there are 2 companies. One is Sumerian, a company in the IT space that I founded with David Siebel in Glasgow in 2002, in the middle of the Depression, I would say. And what we do there, we do IT analytics. That means that we provide insight for companies that have very, very complex IT systems to manage the systems much more efficiently. We have offices in Glasgow, London, Edinburgh, Geneva, and New York. And the last one is Ariadne, and it's probably one that is relevant for what we are going to discuss. Ariadne is a joint venture between Sumerian, Tayside, and the University of Dundee, and Ariadne has developed a platform that integrates patient health information and allows to provide information to manage care much more efficiently. So those are the 4 companies, and I will tell you that just one detail about one case. One day, a Belgian gynecologist phoned me and mentioned to me, Martin, his name is Gabriel, and he and his mother are very well. And this was the best return on investment that I ever had. It was the first baby born using an ECOVA approach and an ECOVA technology. So the combination of IT and life science is interesting. But let's come to the future of health and how technology and mobility are changing the health industry. This is a very ambitious title for a very complex situation that I would say that is very simple in what is happening. The solutions are more complex, but the situation is very simple, and I would like to share with you some ideas, first to understand what are the drivers. Why do we need to change? And I think the most important one is aging. We are in developed countries under the fertility level that allows to replace, to keep the level. Life expectancy is increasing. We could expect that the children that are born today could reach 100 years old. And by 2050 in Europe, in the Europe of 27, we are going to have a median of 48 years old. This is creating 2 major issues, I would say. One is that this segment of the population is growing. The other one is that there are less payers in the system. And the health consequences for that are very significant. You might not be familiar with the term non-communicable diseases, but you are going to hear that many, many, many times over the next few years. Non-communicable diseases are diabetes, cancer, cardiovascular diseases, chronic respiratory diseases, and we can also add neurological diseases. Those diseases represent 86% of the deaths in Europe and 77% of the cost. So with what we are going to have as aging of the population, the NCDs are going to grow. And this is not a projection that is coming for very particular analysis. This is probably one of the most accurate forecasts that we can do, because people that are going to be 85 or 90 years old 10 years from now, they are already born. So this is something that is there, that is coming, and that we need to react. Another example is with Alzheimer. Alzheimer from 65 years old is essentially 1 person out of 7, out of 8. After 85 years old is 1 out of 2. So, and this is creating, and I take Alzheimer again as an example. Alzheimer, the cost of the drugs in Alzheimer is not very expensive. It's few $1 billion, I would say, for the US. But the cost of providing care for the patients of Alzheimer is close to 90 billion. So, and this is something that is building in the system, and we have to react to that. So we are going to have more dependent persons that will result in higher cost. And there is one factor that complicates, I would say, significantly the situation. All governments have no money. They are over-indebted to the bonds. So, and we cannot extract more money from the taxpayers. Maybe in some countries somebody arrives, but I think the system has arrived. We have a convergence of situation in which, on one side, the competitiveness, I'm thinking about Europe, is a little bit at stake, because we have Asia, somehow the center of gravity of the world has shifted. And our governments don't have the luxury of financing partially some transition period, because they are already stretched as much as possible. And on the other side, we have politically, I think, it's difficult to move in order to say we are going to redesign the level of care we provide because we have all been used to have access to a quality of care at a reasonable cost. So politically, it would not be very easy to do, to say we are going to define 2 or 3 layers of care in different countries. The reality is that this is already happening, but not in a structured and institutional way. So here we have a situation that is a convergence of factors that needs a response from our side. And I would say that having been involved with innovation since many, many years, the big driver of innovation is need. When you need, people move. And here we need to have a solution, because this is not something that we can say, we postpone the solution for 5 years. We cannot, because this aging mechanism is there and is moving. So we have to act timely to respond to that. It's not a nice to have, it's really a must. I think this point start to be shared by most of the stakeholders, at least conceptually, governments, health authorities, insurance companies, hospitals, etc., even patients. But when we have to move from the concept to the reality, it requires a lot of energy to make things happen, because habits are very difficult to change. I would just mention some initiatives that are taken, but for example, one of the things that we need to do, and this is not rocket science, we need to do things better. I take one example, referral to transfer. For those of you that are not familiar, referral to transfer is a patient that goes to a generalist, a GP generalist, and the generalist says, you have to go to a specialist. He's going to refer the patient. If this referral is done, the specialist treats the patient in the next 2 or 3 weeks, probably is going to be timely for curing the patient. But if this specialist is taking care of this patient 4 months later, this could be very, very serious for the health of the patient. And it could be dramatically serious for the cost of the system. So there are very small things that can be done managing better what we do today. And I will take another example, and we might have even to import some ideas from developing countries. We have the obsessions to, when we have something, we want to visit the doctor. In many cases, we don't need. We need to have just a nurse. This is going to reduce the cost. Just to say that this is not, for many things that we need to improve, we don't need to have high-tech, very complicated high-tech. We need to do better what we do. The second thing, and this is more complicated, we need to move from acute care to preventive care. Today we are reacting to situations in which a patient has a problem, we bring the patient to the hospital. But probably this instant in time has sent signals over the past 5 or 10 years, and this could have been avoided or delayed. And this is preventive care. And this is a more complex, but I think is a fundamental change that is going to be better for all the participants in health. For that, we need to understand very well the path of the evolution of diseases. We need to, based on that, understand how do we identify the patients as risk, and then to track the patients and make sure that the patient is involved. And I think in this system, the patient has to be in the middle, and technology is going to help to do that. Another point that is important to do is that we need to introduce incentives. The system is not going to change alone because what we are providing is a better solution. So we have when we introduce those changes, we have to make sure that all the stakeholders are incentivized to just move in the right direction. So technology, I think, one of the first elements is to integrate the data. Health data is like silos in different places. It's information that is not standardized to be integrated. So we need to integrate the data in order to allow this doctor that is going to receive the referral to transfer to be able to identify the time, etc. So, and this is what we do, for example, at Ariadne. At Ariadne, we have developed a platform that is not touching the existing systems, because to change the existing systems will be a 20-year project, hundreds of millions of pounds budget. At Ariadne, we have developed a platform that is going to connect to the right databases, and we have defined within this platform the life cycle of the patient in terms of data, and we can work with this information and provide the management information to the administrators, to the doctors, to the persons that are relevant to provide care. The other element that is important that we do in these changes is that today we have two worlds. We have the secondary care, which is the hospitals and the clinics, and we have the primary care, which is the GPs. And we are losing, or we are not using, the tremendous information we have in secondary care to do preventive care at the GP level. It's something like to have a virtual hospital. And if we arrive to extract the information from the secondary care that allow us to understand the profile of the potential candidates for a given disease, and we apply that to the primary care population, we can identify who are the persons that are sensitive, that can be candidates for a certain disease, and the JPs locally can treat these persons. If we do that, we can avoid, we can delay the entrance in the secondary care. Or even we can just avoid that by just managing the situation. And this is something that can be done. The technology exists. And this is linked with the non-communicable diseases. Diabetes, for example. Diabetes is a huge time bomb. Diabetes is a very vicious disease, because over the 10, 15 years, not really, there are no symptoms, not really. But the diabetes is like when you have a car and you have the car with the accelerator too high, it's the same for the body. You are burning, but you don't realize. But this is, at the end of the day, after 10 or 15 years, there are problems with retinopathy in the eyes, amputation, etc., etc. From the cost perspective, from the patient perspective, is obvious. It's a disaster. But from the cost perspective, this is a time bomb. And when you think about countries, there are many countries that have a very high level of diseases, but in the Middle East, you have countries that have, on average, 18–20% of population with this type of diseases. If they don't treat that appropriately, they are going to have a huge toll to pay later. And it's going to be, in certain countries, this is not only for health, this is strategic. You lose your workforce. If you don't deal with this type of illness early on, the workforce, the trained workforce, is going to be reduced. So this is something that for this type of management there, technology can play a very important role with sensors, with smartphones, with mobile phones that are going to be, and it's not just technology, it's education. We have to educate, for example, part of the system to say that to provide care is not just to provide care like that, it's to educate the patients, to educate the nurses, to change the lifestyle, because you can take all the drugs that you want. If you don't change the lifestyle for certain illness like cardiovascular or others, this is not going to move very much. So, and most of the technologies are available. But I cannot resist to mention you a project that is called Guardian Angels for a Smarter Life. This is a project that Adrián Ionescu, a professor at the École Polytechnique Fédérale de Lausanne, has initiated, and this project has been selected as flagship by the European community, and they might receive 1 billion Swiss francs to develop the project. The project is the fantastic in the idea, and this is with a lot of money and brain and effort feasible to do, is that they plan to develop nanosensors that are energy independent. These nanosensors are going to be connected among themselves wireless, and these nanosensors are going to have harvest the energy from the surroundings, whether it is the changes in temperature or the movement, etc. And these nanosensors are going to be first at the person level to track all the parameters that are relevant for this person. Then they are going to be at the environment level to track more questions about the environment, movement, and other things. And then at the end of the day, is going to be at the emotional level for identify needs of, for example, quadriplegic patients and things like that. So we have for most of the things we want to do, I think the technology is available. The thing is that the system is very complex and it's very difficult to align all the stakeholders to move rapidly. So I think the impact on the industry is going to be that we are going to have a continuous, growing pressure on cost. This is there. We cannot just close our eyes. And we have to act rapidly because this is like if a tsunami is building. If we don't change the way we deliver care, we are going to let this tsunami build and build and build, and we cannot just export or so it is important that all stakeholders take conscience of that and react in this moment. And one point is that at the end of the day, everybody is going to continue to do the same. A doctor is going to be a doctor, is going to act as a doctor, but this doctor is going to receive much better information to take better decisions. So it is not going to change to bad the activities of a doctor. A doctor is going to do the same, but the same for the nurse. So the changes in what everybody does are not going to be so much, with the exception of the patient. The patient is going to have much more information, is going to be much more involved, and is going to be at the center of this platform in long-term management diseases, etc. But as I say, given the complexity of the healthcare system, it is important that all the stakeholders just align. And I'm hoping that they are going to do that, they are going to align, and they are going to take the decisions to help our societies to move towards a much more preventive healthcare. And I'm just trying to give my small contribution to it. So thank you very much.